Polycystic ovary, ovarian syndrome, PCOS, is a common hormonal disorder affecting many women between puberty and menopause. It is called a syndrome because it refers to a number of symptoms experienced at the same time. It is also known as polycystic ovary disease, Stein-Leventhal syndrome, or hyperandrogen anovulation syndrome. The condition is usually diagnosed based on the following factors. 1. Its increased androgens, male hormones such as testosterone, as shown by excess hair growth, acne or raised blood testosterone levels. 2. Lack of regular ovulation, irregular menstrual periods, or failure to release an egg from the ovary. 3. A characteristic appearance of the ovaries on ultrasound, polycystic ovaries, Isainia, ACEs, PCOS. Usually, the diagnosis of pcos requires the presence of at least two polycystic ovaries. Having polycystic ovaries alone is not enough to make the diagnosis of PCOS. Where required, your doctor will exclude other rare conditions that may present as PCOS. Who gets PCOS? In Australia, 12 to 21% of women of reproductive age are diagnosed with PCOS. 1. In Indigenous Australian women, the occurrence of PCOS has been reported to be higher. It is thought that PCOS will increase in line with the rising rate of obesity in Australia. Why does it occur? Doctors are not exactly sure what causes PCOS, although it is believed to be linked to both lifestyle factors and genetics. In other words, it runs in the family. Sometimes another family member may have similar symptoms. However, PCOS may be inherited from the male side, where symptoms may not be obvious. Parents and siblings may have some of the metabolic features of PCOS, i.e., insulin resistance. See below. Many women who have PCOS also have what is known as insulin resistance, which occurs when the body struggles to carry out the normal actions of insulin, such as regulating blood glucose levels. High levels of insulin can also increase the production of male hormones, including testosterone, from the ovary, which contributes to such symptoms as excessive hair growth and acne. Insulin resistance can be caused by genetic factors or lifestyle factors, such as being overweight, or it can be due to a combination of both. The symptoms and signs are often different for each woman, but the following characteristics are common. Difficulty in becoming pregnant because of lack of ovulation, ultrasound appearance of ovarian cysts, polycystic ovaries, periods that are absent, amenorrhea, or infrequent oligomenorrhea, excess male hormones causing symptoms such as hairiness, hirsutism, or acne weight gain, and an increase in fat, especially around the abdomen or tummy area, prediabetes or diabetes abnormal levels of blood fats, lipids, such as cholesterol and triglycerides. One of the most upsetting and frustrating symptoms of PCOS is infertility. However, this doesn't mean you won't become pregnant. There are many ways to manage infertility, and a large percentage of women conceive after treatment. In order to better understand the symptoms of PCOS, you might like to familiarize yourself with the process of ovulation, the menstrual cycle, and the role of the various hormones. The menstrual cycle refers to the maturation and release of an egg, ovulation, from an ovary, and the preparation of the uterus, womb, to receive and nurture an embryo. A typical cycle takes approximately 24 to 35 days. Your menstrual cycle is governed by hormone levels in the body, which rise and fall in a monthly pattern that continues throughout your reproductive life. When the cycle is running smoothly, the pituitary gland at the base of the brain produces a hormone called follicle stimulating hormone, FSH, to prepare an egg for release. FSH stimulates a fluid-filled sac surrounding the egg to grow into a follicle about 2 centimeters wide. When the egg is ready, about 2 weeks before your period, the pituitary gland produces another hormone called luteinizing hormone, LH. This prompts the follicle to release one egg into the fallopian tube in the process known as ovulation. Ovulation is the fertile period of a woman's menstrual cycle. While this is happening, the ovaries are secreting other hormones such as estrogen and progesterone to thicken the lining, endometrium, of the uterus and prepare it for pregnancy. The ovaries also produce small amounts of androgens, male hormones, such as testosterone, which is converted into estrogen. If the egg meets the sperm in the fallopian tube, conception may occur. The fertilized egg is swept through the tube toward the uterus, where the embryo, as it is now called, will implant into the lining about 6 days after ovulation. It begins to produce a hormone called human chorionic gonadotrophin, HCG, which tells the body it is pregnant. If fertilization doesn't occur, the levels of estrogen and progesterone drop again, and the lining of the endometrium comes away. This is called your period. Females are born with about 400,000 immature eggs, oocytes, stored in their ovaries. Each cycle, one of your ovaries selects between 10 and 20 eggs to become possible candidates for release. However, generally, only one egg is released each cycle.